My colleagues in Hong Kong U who performed some mathematical modeling, they predicted that by April, the number of cases may come down to about 3 digits. And then by May, it may come down to double digit.
Hong Kong has the highest COVID-19 death rates in the world at the moment. Why has Hong Kong been hit so badly by this wave?
Well, the fifth wave is due to Omicron, and it all started in December last year, started by Cathay Air crew who did not comply with home quarantine, and they actually led to community outbreaks. And then in January, the outbreaks was actually spreading even further by a returning traveler infected with the more transmissible Omicron BA.2. And then it so happened in early February, we also had the Chinese New Year holiday, and there were a lot of family gatherings. So the outbreaks continue to get worse. And another major factor is the sluggish vaccination rates, especially among the elderly. So this time we had a lot of elderly who actually passed away because of their old age and a lot of pre-existing comorbid illness.
But what really is the main difference, do you think, between, say, the first 4 waves and this wave that we're seeing now? Like, why has this wave really taken hold compared to, say, even the last wave?
Well, Omicron is a lot more transmissible compared to other variants. It is at least 4 times more transmissible, even compared to Delta. And the fact that the vaccination rate is so low among the elderly, when they become infected, they get complications, respiratory failure with a high case fatality rate. So if we look at the recent figures, 91% of the deaths, of the fatal cases, only receive 0 to 1 dose of vaccine. So the case fatality rate is about 1.75%. But in contrast, those who have received 2 doses, the case fatality rate was only 0.07%.
A lot of people are saying that Hong Kong had 2 years to prepare for this wave, watching what was going on in the rest of the world, but didn't do enough. How do you respond to that?
Well, indeed, we do not have enough isolation facilities, testing capacity to deal with the big 5th wave. And that was actually quite unexpected.
What can the government do now amidst this 5th wave to actually start to bring down numbers?
Well, at the moment, we only have about 60% of the elderly aged between 70 to 79 who have received 2 doses of vaccine. And among those elderly aged 80 years plus, only 30% have received 2 doses. So we must vaccinate these elderly as soon as possible. And government is also trying to increase the number of isolation facilities and hospital beds, and also ramp up the testing capacity. I guess when the 5th wave is coming down to, say, around 3 digits, if it doesn't go down any further, then the government may actually introduce compulsory community testing together with a kind of lockdown, stay-at-home order.
In your opinion, when should we be looking at introducing mass testing, and is a lockdown, do you think a lockdown is really the only answer to reducing the numbers?
If the number of cases goes down quickly, then there may not be a need to do the compulsory community testing. But on the other hand, if the number is staying around 3 digits, not going downward, then I think the compulsory community testing together with a lockdown would be important. By saying lockdown, I'm not saying that everybody has to stay at home, not allowing to go out. We still allow the frontline healthcare workers, essential workers, to go to work. And every household, there may be 1 member that is allowed to go shopping. So a degree of lockdown would help reducing the transmission in the community while the compulsory community testing is being conducted.
The daily caseload is sitting anywhere between 30,000 to 50,000 a day. Do you think this figure is a true representation of COVID cases in the city, and how high could it actually be at the moment?
I think the number mainly reflects the PCR positive cases. In recent weeks, a lot of people actually rely on the rapid antigen test to confirm the infection. Now, a lot of people may not report their result to the government because of lack of incentives. So only those who need the documentation to get medical sick leave will report. So I think we have to observe for another week to see whether we are actually in the peak or whether we are in the plateau part of it, or whether we are starting to come down. At the moment, if you look at the restricted testing, about 10 to 20% of the specimens are actually positive. So if you take the average, maybe 15% of the population is already infected.
But is this not a flaw in the system if we do have such a large percentage of the population, or even just a certain percentage of the population not reporting their testing, especially if we're still following a COVID or aiming for COVID-0?
Yeah, now this is a voluntary kind of reporting. There's no way that you can actually supervise and get the results. So I think the lack of incentives means that some people in the community may not report the results. So we may not see the true number of infections.
Do you think at this time, realistically, we can still aim for COVID-0? Is that still possible, or do you think the government need to be looking at potentially living with the virus?
Dynamic zero COVID strategy is actually a national policy, but this is only a measure to buy time to improve the vaccination rates. As I mentioned before, a lot of the elderly in Hong Kong have yet to receive the vaccinations. And even in the mainland, they were relying on the inactivated whole virus vaccine before. And there are also limitations with this vaccine, as you know. The antibody level dropped too quickly. So I think once the mainland actually improve their vaccination program, and preferably, hopefully when there will be a second generation vaccine available in the middle of the year, they may revise the national policy. So by then, when the vaccine program is actually more protective, I think there would be some time that the national policy may change. And gradually we will move to another direction.
David, thank you very much for your time today. I know you're very busy.
Thank you.